Come in.
Good morning, Mr. Glasgow. My name is Quinn, and I'm going to be a nurse today. I'm here to do a scheduled head to toe assessment. Would that be okay with you?
Yes.
Okay. May I please see your armband? Will you say your name, please? First and last name?
William Glasgow.
Okay. And your date of birth?
December 1983.
Okay. All right. You previously consented for a head to toe or several assessments throughout the semester for me to perform on you. You previously gave us consent. Is it still okay to perform the head to toe assessment and be recorded today?
Yes.
Okay. Thank you. I'm going to perform hand hygiene. And I am, for the sake of your safety as well as mine, I am going to wear a face mask. Is that okay with you?
Yes.
Okay. At this time, I'm going to check your blood pressure. Thank you. Your blood pressure is really good. 122/78. At this time, I'm going to check your pulses. Okay, thank you. Pulses are good. I'm just going to take a moment to observe your breathing for a full moment, just to get your respiration, sir. Okay, thank you. And we previously checked your temperature, which was 98.3, as well as your pulse ox, which was 97%, and that is on room air. And we do have your weight. Is it documented at 170?
No, 165.
165. Thank you. Okay, at this time, I'm gonna perform hand hygiene again. Okay, so Mr. Glasgow, excuse me. At this time, I'm gonna begin your head to toe assessment. Okay.
Okay.
I'm gonna first take a look at your scalp, and we're gonna go all the way down. We're gonna take a look at every aspect of your head, your scalp, your face, your ears. Take a look at your neck. It's definitely going to be exactly what it is, a head to toe assessment. Okay. Do you have any questions so far?
No.
Okay. Are you having any pain or any discomfort or anything as far as your head right now?
No.
Okay. Are you having any blurred vision or anything that's going on right now?
No.
Have you been, since your last visit, have you had any changes in your vision or had any frequent headaches, neck aches, ear pain, or anything?
No.
Okay. I'm going to start at your scalp. Just take a look around, and then I'm going to work my way down. Is that okay?
Okay.
Should you have any questions throughout the entire assessment, feel free to just ask, okay?
Okay.
Okay. You can just hold your head up. Okay, everything looks good. Alright, everything looks good. Now, are you having any pain whatsoever in your face or eye pain or anything right now? Okay, I'm going to take a look at your eyes, okay? Just focus on my face, okay? Nice and pink. Everything looks good. I'm just checking your beard too for any lesions or any lice or anything or foreign objects. Okay. Everything looks pretty good. Nose is good in midline. Lips are good for pigmentation, which is everything is equal. Alrighty, just checking your ears. Any pain or anything from your ears? Any trouble hearing since your last visit?
No, ma'am.
Okay. Now I'm just gonna check a couple of things. I'm sorry. I'm gonna check a couple of things, okay? Check it for any nodules or masses or anything, okay? Now I'm gonna check your sinuses, okay? Let me know if you have any pain here, okay? Any pain or discomfort. Any pain? All right. Okay, can you clench down on your teeth? Good, good, good. All right, can you open? Good job. All right. Now, can you do me a favor? Stick your tongue out and move it from side to side. Good job. Can you smile really big? Can you frown for me? And can you blow up your cheeks like a puffer fish? Good job. All right, now I'm gonna get you to open your mouth. Oh, just hold your hand still. Open your mouth against my hand. Good job. Good resistance. Now, I'm sorry. Down my knees a little bit. I'm gonna check your neck, okay? Good job. Any pain or discomfort there? Alrighty. Any pain or discomfort in the back of your neck? Okay. No. Now I'm gonna check your carotid arteries. Okay. Just look straight ahead. It's fine. Don't have to hyperextend. Normal, strong bounding. Good job. Check the other side. Good job. Strong and bounding, which is normal. Now I'm just checking for any goiters, okay? Goiters are present with, like, if you have any thyroid issues, okay? Have you been having any problems with weight loss or weight gain since your last visit?
No.
Any problems whatsoever in your neck?
No.
Okay. Now, my next step in our assessment, I'm going to remove my gloves, okay? Actually, before I do that, I'm going to take a look at your ears one more time. No problems whatsoever with your ears?
No.
Okay. What about this side? Any problems on this side?
No, ma'am.
Okay. Okay, can you look at me? I'm going to include this side, and I'm going to say something, and I want you to repeat it for me, okay?
Apple pie.
I'm going to do the same on this side.
Apple pie.
Good job. All right. Now I'm going to remove my gloves, and then we're going to take a look. I'm just going to take a look at your chest, and then I'm going to listen to your heart sounds as well as your breath sounds. Would that be okay with you?
Okay.
All right. I'm going to perform hand hygiene. Okay. Get you to take a deep breath for me, okay? Good job. Good job. Feel. Take a deep breath for me. Good job. More time. Okay. Good job. Okay, I'm just gonna raise your arm here a little, okay? Take a deep breath for me. Good job. And one more time on this side. Good job. Now I'm just gonna take a listen to your pulses, okay? I'm gonna do first, it's gonna be almost the same sequence, okay? But I'm gonna listen twice, okay? I'm gonna listen for your pulses first, and then the next time I'm gonna listen for any swishing or any abnormalities, okay?
Okay.
But if you have any questions, feel free to ask, okay? Good and strong. Alright, now I'm gonna listen for a full minute, okay? Good job. Now I'm gonna listen with the bell of my stethoscope. There we go. The very next, thank you. Your apical pulse is about 70. Okay. Now, the very next step, I apologize, I'm gonna have to go back, is I'm gonna check your visual fields, okay? And I'm gonna check your accommodation to light, and make sure there's no abnormalities. Checking for pupils and making sure that they are constricting as they should. And then afterwards, I'm gonna check visual fields, okay? All right, have any questions so far? And then after that, I'm going to check your mouth, okay? All right, any questions so far? Okay, I'm gonna dim the light for just a moment, and then we'll check your eyes, and then we'll cut it back on, and then we'll do your mouth, okay? Okay. I'm gonna get you to focus on my nose for just a moment. Good job. Right here. Good job. Okay. Now, our very next step is we're going to take a focus on this pen, okay? I'm going to get you to follow the pen, keeping your head straight, and we're just going to check visual fields, okay? Good job. Good job. Okay? I'm going to take a look in your nose, and then I'm going to look in your mouth, okay? Okay? Any bleeding, any trouble breathing or anything?
No, ma'am.
Okay. Now, can I get you to open your mouth for me? Okay. Everything looks good. Teeth well aligned. Nice and moist pink tongue. Can I get you to stick out your tongue for me? Good job. No lesions, lumps, or anything there. Can you say ah for me?
Ah.
Get you to drop your head just a little. Alright, can you say ah for me?
Ah.
Good job. Your uvula moves up pretty good. One more time, say ah.
Ah.
Good job. I'm going to check your reflex. Good job. Alright. Now, I'm going to get you to close your eyes, and then we're going to check for smell, which is also a cranial nerve, to make sure there's no issues whatsoever, okay? Can you tell me if you smell anything?
Orange.
Good. And it is an orange. Alright. Now I'm going to check division hygiene again. So we've done your head, all aspects of your head. We've checked your eyes, your nose, your mouth, your throat, your ears. We've also listened to your breath sounds, and we've listened to your pulses as well, okay? Now, are you having any pain whatsoever in your arms or any type of discomfort, okay?
Okay.
Now I'm going to check your extremities, and then after we check your extremities, we'll be checking your arms and your legs. We're going to check your arms, we're going to do bowel sounds, and then we'll do your legs, okay? After, are you having any pain whatsoever in your belly? Discomfort in your belly?
No, ma'am.
Okay, when was your last bowel movement?
Last night.
Okay, last night. Have you been eating and drinking okay?
Yeah.
Any problems with urination?
No, ma'am.
Okay, any problems? And I ask this because it could be a common issue with male patients. Are you having any trouble starting a stream of urine, or are you having any problems maintaining a stream of urine, like when you have to pee?
No, ma'am.
Okay. The reason why I ask is because if you see any changes with starting a stream or maintaining your stream, or you see any changes with your stream, contact your primary care provider immediately, because that could be a sign of an enlarged prostate, okay? Alrighty. So, I'm going to take a look at your arms. Any problems whatsoever with your arms? You have some good veins. Okay. Any problems here?
No, ma'am.
Alrighty. Alright, I'm just gonna check your cap refill. Very good. Less than 2. And so I'm gonna pinch your skin for skin turn. Good job. Okay. I'm just gonna check your hands for range of motion. Any problems whatsoever here?
No.
Alrighty. I'm gonna check pulses again. Nice and bounding. And check your radial pulse. You could just relax. Nice and bounding. Normal. Okay. I'm gonna check this side. Any pain whatsoever here? Okay. I don't feel any masses or nodules or anything. He does have a brand and he does have a tattoo. No problems whatsoever here. Any pain, itching, or tenderness there? Okay. Alrighty. I'm sorry. Nice and bounding pulses. Okay. Check cap refill again. Good job. Good job. I'm just going to check range of motion here. Any problems with your fingers? Any swelling or anything?
No, ma'am.
Alrighty. Now, I'm going to get you to hold out your arms like you're holding a tray. Close your eyes. Good job. Any problems whatsoever there? Okay, you can open your eyes and drop your arms. May I please ask you to lie down for just a minute? I'm just going to check your bowel sounds, and I'm going to listen for pulses in your belly as well, okay? I am on my knees because I'm pretty tall and my table is a little short, okay? And I do have a baby bump. All right, Mr. Glasgow, I'm just gonna raise your shirt here a little. Looking at your belly, I don't see any pigmentation is definitely equal. No problems whatsoever, no lesions, no nodules or anything. It's not visible. Are you having any pain whatsoever today?
No, ma'am.
All right. I'm just gonna listen into all 4 quadrants of your belly. And I'm going to listen for a full minute on each one, okay? And I will be listening for bowel sounds. And bowel sounds is, we say bowel sounds in medical terms. We say little, almost like growling when you, in layman terms. But definitely notates motility, okay? Anytime there's any abnormalities or you don't hear anything, you have to listen for a full 5 minutes, okay? All right, I'm going to start in the right lower quadrant of Mr. Glasgow's abdomen. Good job. Right upper quadrant. Good job. Left upper quadrant. All right, and then our left lower quadrant. Excuse me. All right, thank you. Next, I'm going to listen with the bell of my stethoscope, okay? And we're just going to listen for any swishing or any abnormalities. Um, Actually, I'm going to listen with my diaphragm first. I'm going to listen for any pulses, and then I'm going to listen with the diaphragm for any abnormalities, okay? Most of the time you can see it, which I can visibly see your pulse here. It's pretty bounding. I'm going to listen. Nice and strong. Checking above the renal artery. And the iliac. Alright. We always listen first, just to be on the safe side, okay? Before we palpate, let me listen for any swishing. There we go. None noted. the next step I'm gonna do is palpate, okay? I'm gonna do light palpation and then I'll do deep palpation, okay? And I'm just checking again for any nodules, any masses, or anything. Are you currently having any problems whatsoever? Any pain or anything in your belly?
No, ma'am.
Okay. Do you have to pee?
No, ma'am.
I always have to ask because we definitely don't want you to pee, okay? All right. In the same sequence as you're listening to your bowel sounds, okay? And you always want to listen first, that's as I said before, because you don't want to hyperextend everything. Well, not hyperextend. You don't want to alter the sounds, I should say, because once you palpate, a lot of times you can kind of get things going, all right? And it'll alter the sound, okay? Now, next I'm going to deep palpate, okay? Any problems, any pain whatsoever?
No, ma'am.
All right. Good job. And last but not least here. Okay, great. Thank you. Next, while you're laying down, I'm going to go ahead and check your extremities, okay? Any pain whatsoever in your extremities?
No, ma'am.
Okay. Any muscle pain? Anything I need to know about before I palpate or just inspect or anything?
No, ma'am.
All right. First, I'm going to perform hand hygiene as we move from our belly to our legs, okay? First, I'm going to turn this so we can see. All right, can I get you to sit up just a little bit? You can sit up if you like, okay? Put those legs up here. Good job. I'm going to check your pulses, okay? Just taking a look at your legs. Looks pretty good. Fine hairs look pretty good as far as growth looks good. No problems whatsoever. Ethnicity. Skin is pretty equal for your ethnicity. We do have a little bit of a tan. Do you wear shorts a lot?
Yes, ma'am.
Okay. All right. I'm going to sit here with you just for a moment. I'm going to assess your pulses. Nice and bounding. Okay. Now I'm just going to feel around for any masses or anything. Any problems with the back of your legs?
No.
Alrighty. I am going to press to check for edema, okay? Have you been having any problems with edema in your legs?
No, ma'am.
Okay. None noted there. None noted there. Okay. I'm going to perform hand hygienes and then I'm going to check your pulses and check your feet, okay?
Okay.
Give me 1 minute. Alright. Just going to check pulses. Nice and bounding. Nice and bounding. I'm going to check the tops of the pulses on the top of your feet as well, okay? Good job. Now I'm going to check for cap refill, okay? Nail bed looks pretty good. Those are all groomed and equal. Cap refill looks pretty good as well. Just taking the skin over. Good job. Now I'm going to check your muscle strength, okay? Can you push up against my hand? Good job. On this side as well? Good job, okay? Can you lift your legs against my resistance? Good job. Alrighty. And can you lift your feet against resistance? Good job. Okay? I am going to check your muscle strength in your extremities too, okay? Can you squeeze my hands? Good job. Can you push me away? Good job. And can you pull me? Good job. Nice and strong, okay? Next, I'm going to get you to turn around as much as you can. And I'm going to take a look at your back and listen to your breath sounds there, okay? Have any questions so far?
No.
Okay. All right. I'm going to perform hand hygiene. And this will be our last step. I'm just going to take your hair and I'm going to lift your shirt here a little just to take a look. Pigmentation is all equal. Just taking a look at it. No lesions or breaks in the skin. Observe. Everything looks good. No bumps, no bruises or anything. Mr. Glasgow does have a tattoo to the top of his back. Any itching noted here recently?
No.
Okay. No drainage or anything here noted to the tattoo or to any places on his back. Okay. All right, my friend. I am going to take a listen. Okay.
Okay.
Take a deep breath for me. Good job. Take a deep breath for me. Good job. One more time for me. Good job. Good job. All right. Everything looks great. Everything looks good and sounds good. No crackles, wheezes, or anything notated. Thank you for allowing me to perform. You're more welcome to sit back now. Thank you for allowing me to perform this head to toe assessments. Did you have any questions whatsoever?
No.
Okay. As previously notated, you work out about 3 to 5 times a week, correct?
Correct.
But you do lift weights, correct? Which is really good. I want you to continue to exercise 3 to 5 times a week. Continue to maintain your healthy diet. Eat your fruits and vegetables. Drink lots of water. And you want to do all that just to maintain your health, okay? You can cut out a lot of chronic illnesses such as diabetes, hypertension, anything of that sort. You have no history, no family history of diabetes or hypertension, correct? Or high blood pressure, I should say, okay? Also, working out could maintain heart healthy as well too. Getting that cardio in, continue to do that, as well as cessation or stopping of smoking and drinking. Do you have a history of smoking or drinking? Okay, good. Keep up the good work. Keep all that in mind to maintain your health, okay? Overall, everything looks great. Muscle strength are 5 out of 5. Just remember, if you have any questions as far as starting a stream and maintaining a stream. When you start to urinate, if there's any alterations whatsoever, just remember to contact your primary care provider immediately just to have your prostate examined, okay?
Okay.
Also, everything looks good as far as your vision, cardiac wise, respiratory wise, everything looks good. Cranial nerves are all intact. Did you have any questions for me so far?
No, ma'am.
All right, everything looks good. Thank you so very much. And if you have any questions, feel free to give us a contact, okay?
Okay.
All right.
Thank you.
So, just to maintain Mr. G's privacy, his peri area was assessed. Everything looks good. No abnormalities, no lumps, no bruises. Everything looks, no discharge noted either. I did don a mask just to maintain Mr. G's safety as well as my safety. Any questions that Mr. G had, I was able to address, but he did not have any questions, so that was a good thing. His overall assessment was very good. He's pretty healthy. Blood pressure was 122/78. Pulses was noted at 72. Respiration rate was checked previously, which was at 97%. His weight was 165, which is really good. Mr. G maintains a great diet. He eats fruits, vegetables, and maintains his hydration really well. He also works out 3 to 5 times a week at the gym. And the health promotion that I did encourage Mr. G to maintain is to continue his diet, continue his exercise, and to continue the cessation of smoking and alcohol use, as they can prevent any chronic illnesses such as diabetes or hypertension. And I also encouraged Mr. G to contact his primary care provider as soon as possible if he sees any changes in his stream of urination or maintaining his stream of urination. Trouble starting a stream could be an indication of an enlarged prostate, as well as maintaining a stream. And sometimes maintaining a stream could be an indication of some type of UTI. So I did encourage Mr. G to contact his primary care healthcare provider as soon as possible should any of these problems arise. I hope you enjoy this assessment, and I hope I did everything correctly. Thank you again. I really enjoyed this class, and I hope to meet most of you and the rest of my cohort at USC. Thank you again.